Dear all, Namaste. In this video, I will be discussing about different types of fracture nasal bones, how to classify them, what is the force of injury, what is the site of injury, like that. The type of nasal injury depends on direction of blow, that may be either frontal, lateral, or from the below, and force of blow, how much force is applied to the nasal bone. Commonest blow to the nasal bone is from the lateral aspect, mostly from the left side. There are different classification systems for fracture nasal bone, but commonly used classification system is by Moore's classification. The fracture nasal bone can be divided into three classes according to Moore's classification. Class 1 is green stick injury. What is green stick? Suppose when you try to break a green stick, that usually doesn't break. The green stick bends but does not fracture. That is green stick injury, usually seen in children where the periosteum is intact but it just bent. That may lead to external nasal deviation in adulthood as the child grows up. Next is simple depression of the nasal bone. There is no comminution but there is simple depression that also can be easily treated by digital pressure. Next is sebaceous fracture. Sebaceous fracture is the vertical fracture of the cartilaginous septum plus fracture nasal bone. Coming to class 2 fracture nasal bone, that is also called as Zarzabes fracture. Zarzabes fracture is fracture nasal bone plus fracture of the bony nasal septum, perpendicular plate of the ethmoid bone and vomer. So if the bony septum is involved, that is called as Zarzabes fracture. If only cartilaginous septum is involved, that is called as sebaceous fracture. Class 3 is naso-orbitoethmoid fracture. I will be discussing it later on. The depressed fracture happens due to frontal blow usually. If medium force is applied, there will be open book fracture. The nasal septum collapses and the nasal bone splays out. You can see here the nasal septum is being collapsed. Okay, there is a fracture here, the bone is being collapsed and the nasal bones splay out, is splaying out the nasal bones. The nose becomes broad over here. If greater force is applied, then nasal bones are shattered. There will be splaying out of frontal process of maxilla and the upper part of the face becomes wider. In this figure, the nasal bones have become shattered. You can see there is shattering of nasal bone, there is comminuted fracture of the nasal septum, and the frontal process of maxilla is splaying out. This is splaying in the upper part of the face. Angulated fracture usually occurs due to lateral force. Medium force from the lateral aspect leads to ipsilateral nasal bone fracture, and greater force leads to bilateral nasal bone fracture and septum fracture, which leads to deviation of the nasal bridge. So in this case, there is deviation of nasal bridge towards one side, and here there is ipsilateral fracture of nasal bone. Greater force leads to crooked nose deformity. Now coming to sebaceous fracture and the Zarzabes fracture. Sebaceous fracture is already been described. Just to recapitulate, this is called as vertical fracture of the cardiac septum due to frontal or frontolateral blow. This is a vertical fracture of the cardiac septum. Whereas Zarzabes fracture is mostly due to lateral trauma. Nasal bones are displaced laterally without gross displacement. There is fracture of perpendicular plate of the ethmoid and the quadrilateral cartilage. Next is the naso-orbitoethmoid fracture. It's one of the severe fractures of nasal bone. The naso-orbitoethmoid fracture is classified on the basis of degree of central fragment injury, which was described by Markowitz et al. In 1991. The type 1 fractures are single non-comminuted fracture of the central fragment without medial canthal tendon disruption. You can see here, this is the medial canthus tendon. This is a small fragment of fracture here. The fracture is non-comminuted fracture of the lateral segment. Type 2 is comminuted fracture of the central fragment, but the medial canthal tendon attached to a definable segment of the bone, so the nose does not become flat. So these are the comminuted fracture lines. You can see black lines here, but the medial canthal tendon is attached to a definable segment of bone. Type 3 fracture is uncommon fracture. Here there is severe central fragment comminution with disruption of the medial canthal tendon insertion. So this is the comminuted fracture. You can see many black lines here, and there is disruption of the medial canthal tendon also. You can see black line near the attachment of the medial canthal tendon. This is all about nasal bone fractures. This question may be commonly asked in the theory examination as classify nasal bone fractures. So you are supposed to write these things. If you like my video, please subscribe my channel Dr. Krishna for more videos like this. Thank you. Thank you very much.